Hello and welcome to the COVID-19 update. I'm Millicent Walker. First, the highlights. Nigeria discovers 3 more COVID-19 cases of the Omicron variant. Oyo State government takes COVID-19 sensitization to religious houses. And as more countries consider vaccine mandates, the World Health Organization cautions that it should be used only if all fails. And thanks for joining us. According to the Nigeria Center for Disease Control, all viruses naturally mutate over time and will continue to happen as long as the world does not act in concert to significantly reduce transmission through vaccination and adherence to effective public health measures. Now, it is important that measures such as the mask use, physical distancing, hand hygiene, and ensuring good ventilation is followed. Meanwhile, compliance with the travel protocols provided by the Presidential Steering Committee on COVID-19 is mandatory for all international travelers arriving the country from any part. Now, here's a look at the latest on the COVID-19 figures.
167 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT, indicating an increase from the figures reported earlier. Lagos logged the highest infections with 113 cases, followed by the FCT with 22 cases, while Plateau registered 16 cases. Other states include Kano with 4 cases, 3 cases were logged in Abia, Kaduna and Rivers, Bauchi had 2, while Delta registered 1 case. The new tally has increased the total confirmed cases in Nigeria to 214,789. 28 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,478. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,980. Currently, there are over 4,000 active cases in Nigeria, while over 3.6 million samples have been tested so far. More than 7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.7 million persons have been fully vaccinated. In Africa, there are more than 8.7 million confirmed cases and over 223,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 266 million, while deaths are beyond 5.2 million.
Staying with the Nigeria Center for Disease Control, it has confirmed 3 more cases of the Omicron variant of COVID-19 in the country, bringing the total number of cases to 6 as the agency confirmed the first 3 cases on the 1st of December. According to a statement by the NCDC, all 6 Omicron cases reported are detected in persons with recent travel history to South Africa. The statement also notes that the UK government has informed the federal government of 7 cases of the new variant detected among travellers from Nigeria. The report of increasing numbers of Omicron cases in the UK has also made the NCDC prioritise the sequencing of COVID-19 positive samples among travellers with a history to the United Kingdom. And more reactions continue to trail the recent blacklisting of Nigeria by the United Kingdom and Canada over the discovery of the COVID-19 Omicron variant. The latest is the Nigeria Governors Forum, NGF, condemning the move of both countries. In a statement signed by the NGF chairman, Efficacy State Governor Kaide Fahimi, it describes the blacklisting as stigmatization, as many countries with higher cases of Omicron are not on the red list. The Governors Forum is calling on the World Health Organization to intervene and set acceptable standards to all for banning countries with new variants of the virus. And to another story, this time in Oyo State, where the government is not resting on its oars in the fight against COVID-19. Now, this is in conjunction with the World Health Organization. The state government and WHO are wooing religious leaders to join the fight. Stakeholders from both the Islamic and Christian faith are being sensitized on how the state cannot afford to throw caution to the wind, especially in the new face of the virus strain.
You're singing, so droplets are coming out of your mouth. So you don't have to shout, you don't have to cough, this.
Constant stakeholder engagement for the fight against coronavirus must not flag across Oyo State. This is the message from both the state government and the World Health Organization, who are in partnership to curtail the spread of COVID-19. Religious leaders are the focus as they are presumed to be closer to the people.
This conference is part of the efforts of the Oyo State government towards sensitizing the people of Oyo State on the importance of preventing the emergence of another surge of COVID-19. The Oyo State government has deemed it fit that it is important to bring religious leaders together because of the trust and confidence that people have in them.
Government says nothing will be left to chance.
We came to realize that there is need for people to be reawakened and rekindled towards their attitudes, knowledge, and ultimate behavior in terms of healthcare service, but most especially on COVID. We did some baseline studies and we realized that people still have so much trust in their religious leaders. And for that, we're now calling on the religious leaders.
Some of the religious leaders who participated say they are better equipped to sensitize the people.
We have learned something very important, which is that COVID-19 can be managed, like polio, HIV, that has been also in the categories of vaccines. And moreover, we have seen the effects and the effort of the government. And so we are not going to liaise with them because they trust us as men of God by encouraging them to go for tests, encouraging them to continue practicing social distancing and all the necessary medical advices.
Vaccination against the virus continues across the state, even as the government scales up awareness campaigns on the adherence to COVID-19 protocols.
And Omicron continues to dominate discussions talking about COVID-19 around the world. And joining us to talk more about that is a public health pharmacist, Biola Ajenifuja. She joins us from our Abuja studio. Thank you for joining us on the program.
Thank you for having me once again.
Omicron is said to be mild up until now. Why are some hinting that it might not be sensitive enough to the vaccines?
Yeah, there's still limited data to really verify that claim. But preliminary studies have shown that there is increase in transmissibility in those Omicron variant of COVID-19. But there are still limited data on it. So we can't really say if it's going to be, it's not going to be the vaccine that we have at hand, like the biotech, the AstraZeneca, and even the Moderna. We can't really say if it's not going to be effective against the Omicron variant of COVID-19. Tests are still ongoing because it's a new variant, so there's limited data on it.
So, and even though the argument is there that there is that limited data, the decisions of some countries shutting off travel from parts of Africa, do you think that they're making the right decision, even if it's not scientific?
Yeah, in my own opinion, I think they are really jumping the gun. Because if someone can present, like the United States now, they've changed the recommendation. Now you have to present a 24 hours negative test before you can cross over to the United States and a certificate of vaccination. I think that's fair enough. But all the other countries that are busy shutting their gates, I think that's what they should do. Because this Omicron they were talking about, is likely it has even been in existence for long. It's just that we're just detecting it now. Like the South African president said, they have been punished for being the first country to detect it. So most likely it's even is already in those countries, and they are shutting their doors to people that are not even having the variant. So what I think they should have done is people should present themselves with a negative test. Once the person has a negative test and has a certificate of immunization, I think the person is good to go and can be let into the country, so that we're not going to face what we had on the first wave, then where we started on the wrong foot, but before we could be able to curtail the pandemic.
Would it be right to say that the Omicron variant originated in Africa? And I'm asking this also based on when you compare what Omicron is to the other variants we've had, the Beta, the Alpha.
In my own opinion, I don't really think so. I think it's because it was first detected in South Africa, I think Botswana on the 11th of November, then 14th of November in South Africa. That's why, as the president said, they are being punished to be the first to detect it. I think it has been around. Okay, like yesterday in the news I heard in Thailand, they discovered a foreigner, and the foreigner didn't even have travel history to South Africa. The first case of Omicron was recorded there in Thailand, and it was from a foreigner. And the foreigner didn't have any travel history to South Africa. So I don't really think the index country or the country of origin of that variant is really South Africa. That's my own opinion. So what I think we should all do is all hands to be on deck to just combat this. This is not the time to play blaming each other or trying to shut your door to people. But let's try and combat this the way we've done with the previous one, so that we can be done with this. And how can we do this? Is by increasing vaccination. And those that have been fully vaccinated should go for booster doses. Then work should still be ongoing to curtail this pandemic, because this thing is mutating. This Omicron is a mutated variant of the other ones that we've been having. So work should still be ongoing. We should not rest on our horse, because everybody is being faced with this. It's not just an African thing, it's the whole world.
So essentially, sequencing is also, we understand, needed to identify as well as understand it. But from a diagnostic point of view, clinical presentation, is Omicron a problem for us?
No, not as the way the Delta variant was really a problem, because you can see it's not as if death cases are rising. Though there are more cases of it, that means there's more transmissibility. That's when people are having it. But the hospitalization and the fatality rate is not increasing. So I don't think it's that fatal. So it's not something to really be concerned about. And so if we can stick to our previous preventive measure, because we've really relaxed on this, if we can stick more to our preventive measures and encourage people to go more for immunization, so everybody is going to be vaccinated, because once we have that, we're going to have herd immunity. And with that, we'll start talking about eradication, because we've done it before with chickenpox, with smallpox, and we are on it with polio, so we can still do it. So I think more advocacy should be done on vaccination, so that many people will become vaccinated, because once people are being vaccinated, there is a break in transmission. It reduces infection, it prevents the disease, and it prevents hospitalization. Even if there are going to be breakthrough infection, with vaccination, it's going to curtail that, and so we won't be having mutated variants of the
strains
of the COVID-19 virus.
We'd like to appreciate your time. Thank you so much, public health pharmacist Biola Janifuja. Thank you so much for coming on the program.
Thank you. The pleasure is all mine.
And to other stories, over a year after the COVID-19 lockdown, some of its negative impact is still being felt. As part of commemorations to mark the 16 days of activism for the elimination of gender-based violence in Damaturu, the Yobe state capital, the GBV subsector working group chronicled the increased incidents of violence against women and children in Nigeria, which were perpetrated during the lockdown. Now, the group disclosed this at a walk calling on the state government to assent to the Violence Against Persons Prohibition Bill.
Ever since the outbreak of coronavirus pandemic and the lockdown announcement by federal and the state governments, there have been an increase in especially sexual and gender-based violence across the country. This group, in a dignity roadblock in Damaturu, the Yobe state capital, believes the COVID-19 lockdown is among the major factors resulting to the increase in the violence against both women and girls.
Because of the awareness creation we've been doing in communities, because of the education, sensitization that is being going on in the communities, people are beginning to know their human rights and beginning to know that they could be violated. They begin to know that these things being done to them is not a normal.
COVID-19 is also a contributing factor, but then we do have a history of gender-based violence, already embedded in the community. But the COVID-19 has sort of increased it, where women have to be, restricted, to particular locations where most of their services are just confined, and they don't have access, to talk about issues that affect them. So COVID-19 is quite a limiting factor, and contributing to more spreading of XGBV.
The commemoration takes the group to the State Emergency Management Agency to present their request in a letter to the state government to assent to the Violence Against Persons Prohibition Bill passed by the State Assembly.
Today, we raise our voice in pain and kneel before you in agony to call for your expanded support for assent of VAP law by His Excellency, the Executive Governor of Yobe State.
From our level at the State Emergency Management Agency, we would like the GU Subsector Working Group will create a special desk for a focal person or representative that will be liaising with the working group in terms of responding to the plights of the survivors.
As countries across the globe continue to battle with the disease, the general public is optimistic. Signing the Violence Against Persons Prohibition Bill will minimize the menace.
Still ahead, COVID-19 vaccine mandates continue to be a topic of debate. We'll tell you about it when we return. Welcome back. As the highly transmissible Omicron COVID-19 variant has now been confirmed, found in 16 states across the U.S., and health experts saying it will likely be detected in the city within a number of days, Chicago teachers are on high alert regarding the virus. Elsewhere, COVID-19 vaccine mandates continue to be a topic of debate. Some countries struggle to encourage a voluntary take-up of vaccines, which are proven to greatly reduce the risk of severe infection, hospitalization, and death from the virus. Well, some governments are considering or have already stated that they will introduce compulsory vaccinations. Well, joining us to talk more about this from Chicago in the U.S. is Dr. Damilola Adeyemi, Infectious Disease Section Head Chairman, IPC Program, Swedish Hospital, North Shore University Health System. We'd like to thank you for joining us on the program.
Thank you for having me.
I'd like us to begin from the COVID-19 vaccine mandates. What's the situation where you are?
Yes, thank you for that question. So basically, employers have mandated the employees to get vaccinated. We have evidence to show that people who are vaccinated are protected from this infection. And on the rare occasion when they get infected, they're not as sick. They just have mild disease. They rarely need to go to the hospital, and they very, very rarely die from this if they're vaccinated. The vaccine mandate, it's a lot of issues with that. In my organization, it was implemented, and employees who decided not to be vaccinated are currently not at work. This is just because we take care of patients, and we want to make sure that patients have a peace of mind when they come into our institution, that they're going to be taken care of by people who are fully vaccinated, and they're not going to get infected from being in our institution.
But
and apart
Dr.
from
Adeyemi,
that,
does that mean that they're fired or?
Well, basically they have a choice. They can, technically, yes. This was not done immediately. It was done in phases. So they were given the opportunity it's over like 2-3 months to get vaccinated. Initially, they were put on no pay. They were still on the list of employees, but starting December 1st, those people are no more here. They're always welcome to come back. We're doing this for their own good. You also have to know that if you're vaccinated, you're also protecting grandmas, people who you live with, family members at home. We all have different family members who have different medical conditions. Some of them immune compromised. Some people have cancer and they're taking chemotherapy. So they're even if they're vaccinated, their system does not, work as well as you and I who don't have all this condition. And so that helps to protect our family members as well.
So essentially, for the overall benefits, it appears to favor. But let's talk about Omicron. Doesn't that put a clog in the wheel in the argument of vaccines, seeing as even though we heard from our earlier guest that all of the data isn't there yet to know if the vaccines can protect against Omicron variant?
So that's a good question. The argument is actually in favor of getting vaccinated. So the Omicron variant that we have now, yes, we know that it does have some genes that predicts that it has an increase in transmissibility as well as risk of evading the immune system. But we also know that if you are vaccinated, and I've seen this clinically, people who come to the hospital who've been vaccinated and get infected, they have mild disease. So the vaccine will still protect you. And what we say is, if you're eligible to get a booster, you should go ahead and get your booster. The people who are boosted are rarely going to get any form of infection from this variant. It will overpower the Omicron variant, is what our speculation is. And like I said, this is all speculation. And if you look at data coming out of South Africa, a lot of people who are having the infection are younger people who are not vaccinated. Amongst their older population who have been vaccinated, I think almost 57%. Those are not the people who have been admitted to the hospital or who have been seen. It's majority people who are younger that are getting infected. Unfortunately, from reports we have so far, these have been mild infections. But it is too early to say. It is too early to say. We need some more time and some more data to be able to make definitive conclusions. But overall, the vaccine, getting vaccinated is our only way out of this pandemic.
Let's
and
look
not
at
just
schools.
vaccinating
Okay.
people in the US.
Go ahead.
Sorry, beg your pardon?
Yeah, just
And not just
land on
vaccinating
that
people
note.
Sorry, not just vaccinating people in the US, it's vaccinating everybody in the world, because otherwise we're just going to have new variants coming from, Kinshasa, from any part of the world where the vaccination rate is low and the virus has the opportunity to just, invade and multiply. And these variants come because the virus is multiplying and dividing, and there will be mistakes. And that's why we have a new variant. So overall, we all know the vaccines work. And our only way out of this pandemic is to vaccinate almost everybody, actually, is to vaccinate everybody. And so my last message would be, if you're not vaccinated, please go and get vaccinated. If you're vaccinated and you're eligible for a booster, please get boosted. Get your booster shots. And above all, please continue to observe those mitigation strategies that we talk about all the time. Try to wear a well-fitting mask when you're in an indoor place where there are other people. Try to social distance as much as possible. Avoid large gatherings. Wash your hands, and just observe those things where we can end this pandemic if all this is done.
Another thing that I keep thinking is if we can get a vaccine that can perhaps stop transmission, maybe that would be, that would really help.
Yes, the vaccines that would really help. But we've gone. If you compare, if we had this vaccine at the beginning of the pandemic, if this vaccine was available, millions of lives would have been saved. Millions of lives would have been saved. The goal of the vaccine right now is to prevent you from getting sick and needing to go to the hospital or dying, which is the ultimate. You know, I get where you're coming from, that people can still transmit this, but if you're transmitting and you're not getting very sick, or and you don't need to go to the hospital and you're not going to die from it, it's
half bread.
Exactly.
I understand. We appreciate your time. Thank you so much. We've been speaking to Dr. Damilola Adeyemi, Infectious Disease Section Head Chairman, IPC Program, Swedish Hospital, North Shore University Health System. Thank you for joining us on the program.
Thank you for having me.
WHO's Regional Director for Europe says vaccine mandates are an absolute last resort. Plus, Uganda detects East Africa's first case of Omicron variant. Here's more on the global update.
Ja, dann. Danke sehr.
Alles klar,
ja,
danke.
As more countries consider making coronavirus vaccination mandatory, the World Health Organization has cautioned that inoculation mandates should be seen as an absolute last resort.
Mandates around vaccination are an absolute last resort and only applicable when all other feasible options to improve vaccination uptake have been exhausted. They have proven effective in some environments to increase vaccine uptake. But the effectiveness of mandates is very context-specific.
During a WHO briefing, the Regional Director for Europe adds that while the Omicron variant is in sight and on the rise, it is the Delta variant that is the problem in the region right now. In the UK, new rules for people travelling to the country have come into force to limit the spread of the new Omicron variant. From today, all travellers aged 12 and over will have to show proof of a negative PCR or lateral flow test, even if they are fully vaccinated, taken no more than 2 days before departing for the UK. There are currently 437 confirmed cases of the highly mutated COVID strain in the UK. Uganda has become the first country in East Africa to detect the Omicron variant of the coronavirus. The country's Ministry of Health says 7 cases of the variant have been confirmed in the country. It says 5 of the cases arrived from Nigeria, while 2 arrived from South Africa. And finally, almost 70 medics who attended a large Christmas party in southern Spain have since tested positive for COVID-19. Most of the 68 infected are doctors and nurses working in the intensive care unit at Malaga's regional hospital. Authorities say the infected staff were all fully vaccinated and are showing no symptoms.
Our website, channelstv.com, has more updates and also a better understanding of the pandemic. Take a look. Stories at your fingertips. Well, that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.